And welcome back to Your Pet, Your Vet. Last couple of shows, we've given you an overview of Lake Chatuge Animal Hospital, the setup, where we are, and the equipment, and all of the lay of the land, so to speak. And then the following week, we talked about Tri-County Animal Clinic over in the Murphy area, which is the satellite. Today, we're going to move on to, I want to talk about something that's near and dear to me, and that's the first step in evaluating a pet. And it's called the physical exam. Nothing magical about this, but it's so important. As you visit with us from show to show, we'll be showing you some fairly sophisticated diagnostics, but it all starts right here with the physical exam and the history. And when I say the history, that's the information the client provides to us that gives us the background so that we know what's going on. And I'd like to show you the document that we use to show you how comprehensive it is. As you can see from the form, there's a lot of information, simply date, client's name, pet, and so forth. We're really big about weighing pets every time they come in because we learn a lot by that. The BCS stands for body condition score. We get into temperature, pulse, respiration. And then as you'll notice, we'll ask questions about if your pet coughing, sneezing, any abnormal discharge, any scratching, any vomiting, appetite, bowels, any change in water intake. All of these historical questions are very important. We break down the physical exam so that we evaluate these items that are listed 1 through 12. General appearance, mucous membrane, eyes, ears, lymph node, respiration, circulation, digestive system, the reproductive system, the nervous system, musculoskeletal, integument, which is the skin. All of these things we actually cover throughout the physical exam process. And it's critically important that we cover all these things, or frankly, you'll miss things if you don't. Okay, we're starting with the physical exam. This is our patient. His name is Brody. Brody is a mixed breed dog. We actually know his genetic makeup because we did a DNA wisdom panel testing, it's called. Believe it or not, Brody is a Beagle, German Shepherd, and Whippet cross. If you look real closely, you can probably see those breeds in him. I definitely can tell you he has a Beagle personality. He loves to hunt, and he loves to get that tail going when he's hunting. And he's got the sincerity of the German Shepherd, and sometimes you'll notice when his ears stand up, he gets a little bit of the Whippet look. So that's a really interesting information that we've learned about Brody. I have with me Justin Lee. Justin is our managing veterinary assistant. He also manages our client and patient services, which is really important to me. We're in the service business here, and Justin makes sure that our clients and patients are being well cared for. He does a lot here. He's been with me since day one, and he's a very important employee in terms of his work here. He's our leading veterinary assistant and does a fantastic job. Now let's talk about Brody. Brody is an 8-year-old, and I already mentioned his breed. He's a male neutered pet. But he's here just to be checked out. And I want to talk to you about the physical exam and how it should be done. I like to refer to it as a tip-to-tip exam. We literally look at Brody throughout the whole process. I like to go systematically, and the way I do that is go from the nose to the tip of the tail. So we start out, take a look at Brody's face, make sure everything's okay, look for any obvious injuries or swellings. You got to look at those teeth. This is called flipping the lip. Take a look at those teeth, see if he needs any dental care. As you can see, he does have a little bit of tartar here. He's got some gingivitis, so that's something we're going to have to address at some point. Over here, we do the same thing. Actually has a little hyperplasia right here from that gingivitis. So his teeth look pretty good, except he's got some dental needs, which we'll have to address. I always get them to open their mouth, look inside that mouth, check out the tonsils, make sure there's no masses, and so on. We take a look at the eyes, make sure they look okay. We look at the pupil size, we look at the conjunctiva, which is tissue around the eye, the sclera. We also use an ophthalmoscope routinely if we see anything wrong. And then we look at the ears. Got to take a look at those ears. Just basically look to see if they're clean, or is there any wax, any excessive wax, or any inflammation, any discharge. As you can see, Brody's ears are very clean. Then we come over here and do the exact same thing. And of course, the client has already told us if there's any, we ask them about these ears. And we take a look, we use an otoscope when in doubt. These are the instruments located over here, which are our very important tools. This is the ophthalmoscope. And this actually gives us the advantage of not only looking at the surface of the eye, but we can actually look at the retina. So this is a very helpful tool. And this is the otoscope, which allows us to look in the ear canal all the way down to the eardrum or the tympanic membrane. You got to be really careful because you don't want to hurt them, but we're very good at this, and we just take a look all the way down to see if everything's okay. And that's very important. Now we move on down to we evaluate the lymph nodes in the neck region. This is very important because it's some problems. It will be reflected in the lymph nodes. There's lymph nodes here in the shoulder region we check for. We go ahead and palpate their legs, make sure everything is okay. And then I'll start moving my way down to the body. I'll also evaluate the neck, make sure there's no pain or discomfort with neck movement. This is very important. As you can see, Brody's pretty happy fella. So now, this is the very important part here. We're going to listen to his chest. We start by listening to the upper airways. This is actually the trachea, and it allows us to evaluate the upper airways. We're listening for any changes or abnormal sounds. You have to know the normal to know the abnormal, is what I explained to my staff. So that comes with time, of course. And then we listen to his heart. It's okay, Brody. We listen to his heart, and there's a certain rhythm, a rate, and we listen for murmurs. And we listen to both sides. This is the left side, and then we work our way up through the lung field. For sake of time, I'm going to go ahead and just kind of quickly do this. And then we describe the characteristics, and if we find anything, of course, we may have to do additional studies. All right, so we've listened to the lung fields, we've listened to the heart. Now we work our way to where we palpate the abdomen. This is very important. I always explain to clients what I'm looking for is there any areas of sensitivity or pain or any palpable masses. Quite frankly, if it's a fairly large mass and you get pretty good at this, you can actually palpate them. And so as you can see, I'm just basically very systematically from the cranial or the front, work my way back to the caudal portion of the back. And we're just checking real good to make sure there's no sensitivities, no pain, any discomfort. Then we also check the quality of the skin. Take a look at the skin and see if there's any flakes, any obvious fleas or parasites or ticks. And this is something we do very thoroughly. And then we're going to work our way back towards the rear parts. I like him standing. He's getting a little restless, which is understandable. There's a lymph node right here I like to check called the popliteal lymph node. There's another lymph node called the inguinal lymph node I like to check. Of course, he's a boy dog, so we want to make sure his is all right. Sorry, folks, but this is important too. Make sure there's no abnormal discharge. We check his rear end. You'll be surprised. A lot of dogs can get tumors or masses back here, so you got to look. And then we also check his pulse. This is very important because this gives us an idea of the strength of his heart and how well the blood is flowing through his body. So we check the rate and the quality of his pulse. We go ahead and check his feet, make sure everything's okay. And again, we do that with all 4 legs and just check him literally from tip to tip. One point I want to make, this I should have mentioned when I was at the head, we want to check his mucous membrane color. This is really, really important. They're nice and pink, and then we also do this test here called capillary perfusion time. As you can see, I'm checking to see how fast the blood comes back to the mucous membranes when I press, and that's very impressive. That should happen very quickly in a healthy pet. So again, along with the history and the physical exam, we can really, and again, I can't stress how important the history is because that kind of points us in the right direction. Although you will learn from watching this show that we have so many fancy tools and really important tools to help us with diagnostics, it all starts with the history exam. I think the veterinarian's a lot like a pediatrician. A child can't tell us what's going on, so we have to rely on the family to tell us what they observed at home, and we take that very seriously because that's our history. And then, and frankly, 95% of the time, I can usually determine what's wrong with just a history exam. Maybe 90% of the time. So, but I just want to stress how important that is. So, make sure your veterinarian is doing a very comprehensive physical exam because, frankly, it's the most important part of the health, of the wellness process. Thanks a lot for coming and joining us today. Next time we're going to give you an overview of some of the diagnostic tools we have available when we have to do additional testing. So we'll see you next time.